Hi, welcome to Learning Plan 3, preparing for the RN role. Now, first off, you're going to notice immediately that the recording environment is different. I'm at home right now. Not going to go into a lot of details, but I am having some family health issues, and I've been driving to Wausau and back frequently. I just didn't have time to get down to school to record this lecture, so I'll be recording it from home. Other than that, same information, just no whiteboard. So it'll just be me talking, and that's okay because I'm just so exciting that you don't need to see me right on the board anyway. Pardon me for that. So let's just get going on this. There is a lot of information here. I will cover everything to some degree, and some things to a great degree. Those things obviously are the most important concepts that you need to know. So let's talk first thing first. To become an RN, you need to graduate from school, but that's the first step. The second step is, of course, probably the most important, passing the NCLEX. Now, how many of you are LPNs? Now, obviously, if you raise your hand, I'm not going to see it. But my guess is with 17 students, 4 or 5 of you are probably LPNs, and you've already taken the NCLEX. Well, the NCLEX RN is the same. It actually has fewer questions than the LPN, but still got to take it. It's stressful. It is very stressful. I would imagine that if you have taken that NCLEX, you know exactly what I'm talking about. If you haven't, well, you'll know. Gotta have my coffee. So the NCLEX is the National Council Licensure Examination for Registered Nurses. You don't need to know that. Who prepares it? It is the the National Council of State Boards of Nursing, the NCSBN. It is a national exam with standardized scoring. I'm sorry, got something in my throat. What that means is every graduate across the country takes the same test design. Of course, not the same questions. The question bank is enormous, but everybody gets the same type of questions. Same test plan is used for everybody. The test plan is reviewed and revised about every 3 years. The most recent revision actually increased the passing score by a little bit. They made it a little bit harder, less than 1% harder. But so that's that. You pass, you're an RN. If you don't pass, they give you a chance to take it again. Now, for those of you at LTC, we have a very, very good first attempt pass rate, over 90%. Over 90% pass on the first attempt at LTC. Other colleges have also very good pass rates. The technical system in this state provides really good education and results in very high pass rates. So all of you guys out there, you will all likely pass on the first attempt. So why do you have to take an exam? I mean, isn't just graduating from nursing school enough? Because really, if you think about it, the NCLEX doesn't give you any more knowledge. It doesn't really validate what you know. It does, but you've already got that knowledge and you passed out of a college. So what does it do? Well, because it's standardized, it makes sure that everybody meets the same minimum requirements, and it ensures public protection. It measures competencies that are needed to perform safely and effectively as a newly licensed entry-level registered nurse. I'm having a hard time seeing with my bifocals. Sorry about that. If you haven't noticed, sometimes my lectures are a little bit odd. That's only because in person they're a little bit odd. I want you to have the same experience as anybody who's sitting in my classroom. But anyway, so the NCLEX ensures public protection by making sure that all of you have mastered the competencies to perform safely and effectively as a newly licensed entry-level registered nurse. They're not going to test you as though you were a 15-year ICU nurse, newly licensed. That's fair. Everybody takes the same test. And remember, it ensures public protection so that everybody is efficient and safe. The NCLEX test plan is a blueprint. As I mentioned, it's researched and potentially modified every 3 years. The first thing to do when they research to potentially update it is they do an analysis and do a survey. The survey is of about 12,000 newly licensed RNs, and they're asked about the frequency and importance of performing 155 nursing care activities. So 12,000 new nurses are asked about 155 nursing care activities. And then they're analyzed to see which are really the critical skills that you need to know, which are the critical skills that need to be done to be safe and efficient. And that analysis then guides the modification of the NCLEX blueprint. Again, we're looking at the knowledge of a new grad. Within 6 months of getting their license, what do they need to know to be safe? That's what the NCLEX tests. Now, the NCLEX is 4 main categories of questions with some subcategories. And, you don't really need to know this so much to necessarily pass this class or pass the NCLEX, but it helps you understand how to study. The 4, and really, that's part of the goal of this class, is that you know how to take the NCLEX and pass. I want you to all pass. The 4 main categories of safe, effective care environment, health promotions and maintenance, psychosocial integrity, and physiological integrity. All right, those are the 4 main categories. They're further broken down. Safe and effective care is broken down into management of care and safety and infection control. And physiological integrity is broken down into basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, and physiological adaptation. Again, you don't have to know all those to pass this course, but you have to understand how the test is designed, how the NCLEX is designed, because I want to give you as much ammunition when you go into that testing center as possible. The way they design the exam is everybody gets the same percentage or approximately the same percentage of each of those categories of questions. And of course the percentages will range, because the number of test questions you'll be receiving will differ, and we'll talk about that in a couple of slides. In health promotion and maintenance, that's a really important topic, right? Only 6 to 12% of the questions are on that topic. The same with psychosocial integrity and basic care and comfort, 6 to 12%. So health promotion and maintenance, psychosocial, and basic care and comfort, 6 to 12%. Small. Safety and infection control, 8 to 14%. A little bit bigger. Reduction of risk potential, 10 to 16%. I like using hand gestures. Physiological adaptation, so how the body adapts to illness and health, 11 to 17%. Pharmacological and parenteral therapies, 13 to 19%. If you don't have a good handle on pharmacology, if you don't know your meds, if you don't know what meds treat what conditions, what side effects are potentially there, how the treating of one condition can lead to another condition, you're going to have a challenge on this exam. That is a big part of the exam. But there's one part larger. Management of care, 16 to 22%. Roughly 1/5 of the questions will come from this class and topics that this class addresses. So this class may not be an exciting class. I'll be the first to admit that. It's not the most awe-inspiring topics. It doesn't give you the same rush as working in an ER or an ICU or running a code, but when 1/5 of your questions come from this class, it's a pretty darn important class. So how does now there's a nurse licensure compact, and the compact is an organization of 24 states that have gotten together and agreed that a license in one state will be good in another compact state. Wisconsin is part of that 24 state compact. So when you have a Wisconsin license, you'll be able to go to any of the other compact states and work under your license. You have a multi-state license. It's not kind of nice. It's very nice. You still have to comply with the Nurse Practice Act of that state, but you do not have to do any special testing to practice there. 24 states are in the Nurse Practice Act. That means 26 are not. Unfortunately, all of the states that surround Wisconsin are not part of the Nurse Practice Act or Nurse Licensure Compact. They have their own Practice Act. So if you go to Minnesota, you'll have to contact their Board of Nursing and find out what you need to do to get their license. You will not have to take another NCLEX, but you may have to pay a different fee or do some paperwork. Every state has its own set of hoops to jump through. Likewise, Iowa, Illinois, Michigan, Indiana. I don't know how we got lucky to be in this island of non-compact states, but we are. Preparing for the NCLEX is very important. If you go out to the learning plan, I think there's a link to preparation for the NCLEX. If there isn't, go into the PowerPoint lecture that is in the learning plan. And on page 11, there is a link that will take you to how to prepare for the NCLEX. Now, the NCLEX uses computer adaptive testing, and that just sounds scary, doesn't it? What is computer adaptive testing? It means that while everybody takes the same type of test, nobody takes the exact same test, every test is different, meaning different questions and different lengths of tests. For the RN, the minimum test number of questions is 75. The maximum is 265. You could have anywhere in between, from 75 to 265. You can pass with 75. You can fail with 75. You can pass with 265, and you can fail with 265, and any number in between. How does it work? The test is very complex. It's pass-fail. You'll never find out what you did right or wrong. You'll never get a grade, which for many type A students, which is almost all of you, this is the most frustrating test you'll ever take because you'll never really know how you did. Well, I'll tell you how you did. You got about half wrong. Everybody gets about half wrong. It's designed that way. Let's back up and explain that. The NCLEX is designed to test your minimum safety levels of a newly licensed RN, right? So minimum, just they want to make sure you're safe. They want to make sure you're not going to kill a patient, to be blunt. So how do they do that? They test you and they push you. They push you hard. They push to see where your limit is. We all have limits. If I took a computer adaptive test at my level, I've been a nurse for 18 years. If I took a test similar to the NCLEX, I'd get a lot wrong. We all have limits. No one knows everything. And anybody who says they know everything, well, we won't talk about that. The test starts out with a question, generally an easy-ish question, a mid-range question. When you get it right, the next question in that category, say pharmacology, the next pharmacology question will be a little bit harder. And when you get that right, the next pharmacology question will be a little bit harder, and a little bit harder, and a little bit harder, until you fail one. And you will. It's just going to happen. When you get one wrong, the test backs it up again. Easy, 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 harder, harder, harder. Oh, back it up. Easy, harder, harder, harder. And it does that for every category. All those 4 main categories and the subcategories. Starts easy, and then it builds. And what it's doing is it is trying to dig exactly how deep you really know your information. So it goes deep into your knowledge, and you will get about half wrong. You will get questions that you don't even know what the question means. That does not mean you don't know your stuff. That means the test is working properly. It's supposed to push you. It's supposed to make you sweat and doubt yourself. Why would it do that? Why would it make you doubt yourself? Wouldn't that be counterproductive? Think about it. When you're out there taking care of patients for real, you're out there working, are you going to know everything? And is everything going to go exactly according to plan? Not on your life. You're going to be pressed. You're going to be pushed. You're going to be stressed. You're going to be at your limits of what you can handle, and then something is going to happen on top of it. And you need to cope with that, either by delegating or finding a new efficiency or triaging your patients. Whatever you have to do, you need to handle that. And then something else is going to happen. And then eventually you get to go home or you pass out, one or the other. This test does the same thing. It gives you, in essence, a normal assignment of patients, and then it starts making your patients sicker and sicker. It's putting you under the same level of stress as you would be on the job. It wants to see how you handle it. Now, it can go up to 265 questions. That is a boatload of questions. You have just over 6 hours you can take breaks, but the breaks, you don't get a I believe they have one 10-minute break in there that doesn't count against your time limit. Any other break counts against your time limit. You have about a minute 10 seconds. If you got the 265 questions, you have about a minute 10 seconds per question. That's it. So now that may explain why your tests are timed in school, why your instructors give you limits. Because in real life, you have limits. When you're working on the job, you don't have 5 minutes to think about what to do next. You have to know. So this test, again, simulates real life. It gives you a defined limit of how long you can think before you could potentially run out of time. Now, of course, if you get only 75 questions, you have a lot of time. But unfortunately, they don't tell you up front how many questions you're going to get. So, assume, it's just safer to assume that you're going to get all the questions. When you start taking your practice exams, and you should start taking your practice exams now, time yourself. Give yourself a minute, 60 seconds per question. That's harder than what the NCLEX gives you. But practice, train yourself for 60 seconds per question, so that when you get there for real life, that's one stress that's gone, because you're already used to that. So what happens? What happens when you apply? To apply for the NCLEX, at the beginning of your last semester, you'll send an application to the state. Now, the state does an online application now, so it's strictly all online. The nursing school will verify your graduation status. So generally, like at LTC, the Monday after graduation, all your credits are confirmed and you are officially graduated, and then we contact the state and say, yes, these students can take the test. You will receive an authorization to test, and then you can set your appointment. Here's my recommendation. Set that appointment as soon as possible, because every day you're out of school, you're going to lose a little information. You were at your freshest the day after graduation. Now, I know everybody says, oh, I'm going to study. And maybe you will. Maybe you won't. If you do, great. It's going to keep it fresh. If you don't, take that test quick. The sooner you take it, the more likely you are to pass. So, when and where do you take the test? There are testing sites all over the state. For Green Bay, the closest one is in Milwaukee. I'm not sure where everybody else is. I would guess La Crosse or Eau Claire, but I don't know for certain. You will only get a license in the state where you take the test. Now again, if you take it in Wisconsin, you get a multi-state license. If you decide to go over in Minnesota to take the license, you will get a Minnesota license, and that's it. Which is fine. If you live in La Crosse and you plan on working in Minnesota, get a Minnesota license. You have, again, 6 hours and up to 265 questions. And by the way, 10 questions are always test questions. They're testing the test questions. Those are the questions that you might not have a clue what they're asking you. So when you get one of those questions, remind yourself, oh, that's probably one of the test questions. They don't count. Get it right, get it wrong, does not matter. What they're doing is they're evaluating the effectiveness of those questions, should they be used or not. So when you get a question that you don't know, just say, oh, that one probably is one of the non-counting ones. It'll help you save your mind. Computer literacy, well, the fact that you're taking this course online says that you're already computer literate to the point where you can take an online test. So don't worry about that. There is a test session when you go there. If you want to just practice using the mouse, practice using the keys, you can. And I would recommend that you do it just to remove another stressor that's potentially there. The test administrator is available for questions, but they answer very few questions. Again, it's pass-fail. There is no number, there's no percentage of what it means. It is what it is. And, that's okay, because life is pass-fail. I mean, think about it. When you're working, does your manager give you a grade, or do they say simply good job or you need to work on it? That's pass fail. So life is pass fail. You either know how to do it or you don't. Most people don't care that your bandaging skills are perfect, or oh, you drew up that insulin just so perfectly. I'm so excited that you did it so perfect. You either got the right amount of insulin in or you didn't. The bandage is either in place and stays there or it doesn't. Pass fail. When you pass, you are lucky. When I passed back in the Stone Ages, I needed to wait for a letter. We were told that if you received a letter in a big manila envelope, kind of thick, you passed. Your license is in there along with a lot of other paperwork. If you receive a business envelope, you failed. It took 9 weeks to get my results. 9 weeks. How would you like that? You can get your results the next day. There's a couple ways of doing it. You can pay to Pearson VUE, I think it's like $8 for your results faster. Or you can just go out to the Department of Licensing and search your name. And when you find your name, after graduating, everybody will have a graduate license or temporary license. As soon as you pass it, the word temporary will be changed to permanent. Then you know you passed. There's another way that people have found that works to find out if you pass or not. It's totally unofficial, but apparently it works. The computer knows if you passed or not. The moment that your test is done, it's already been graded. So you can go back out to the Pearson VUE website and try to apply for the test again. If it lets you apply, that means you need to retake the test. If it doesn't let you apply, you've passed. So the test is mostly multiple choice with 4 options. Some will have multiples. You will get some questions that are select all that apply. You will probably get some questions that say put this in the correct order. Some will have you use your cursor on your mouse and point to a specific part on the body. Some will potentially have you listen to a sound and take action based on the sound. But most of the questions are multiple choice with 4 answers. Now, of the 4 answers, only 1 is right. 3 will be very close to right. 1 is right. And the one right one might not be the absolute best answer, but it's the best of the available answers. For example, let's say the question was a simple one, like you walk into your patient's room and you see him or her. You walk into your patient's room and you see him or her slumped in bed, appearing to not breathe. What should you do? Well, the best possible answer would be what? Assess the patient, right? Can't do anything else until you assess. But if that wasn't one of the possible answers, what would be the next potential best answer? I don't know. But what I'm saying is, you might see four potential answers, and none of them are the right best answer, but find the one the best of the ones that are there. It is a tough test. And by the way, you get 1 question at a time. You don't get another question until you answer that one, and you can't go back to change any answers. one question at a time. So again, remember, about a minute, 10 seconds per question. If you're stuck, if you are absolutely stuck and truly have no idea what the answer is, what the question is, just answer it and move on. If you don't know, don't waste time on that question. Move on to another one. Bottom line, if it's a multiple choice with 4 questions, you got a 25% chance of getting it right anyway. And if you get it wrong, you're going to get them wrong anyway. Answer it, move on. So when you, if you need to change your appointment, you need to contact them at least 24 hours in advance to change your appointment. If you miss that deadline, your authorization to test is invalidated, and you must re-register and pay the $200 fee again. So don't miss it. When you get there, bring a form of ID, valid, non-expired ID with a photo and a signature. Driver's license. Just bring your driver's license. Your testing center will have a quiet environment. It's going to give you a large work surface. It will allow you to work at your own pace. So that's nice. Now, these are very secure centers. When you go in, they do pretty much a full body pat down. You are required to take everything out of your pockets. You can bring nothing in with you except glasses. And they will probably look at your glasses to make sure that there's not a camera built into it. No calculators. There will be one in the room. No pencils or pens. There'll be a whiteboard in the room with a marker. No tissue paper. No Kleenexes. No nothing. No snacks, no beverages, no food. Dress comfortably. You could be in that room for 6 hours. When you go in, they're going to take a fingerprint. They're going to take your signatures. I think they also take a palm print. They're going to take your picture. If you need to leave the testing area for break, you have to have permission to leave. When you arrive, they'll have you lock everything up in a locker. Thank you, that was the word I was looking for. But there's no reason to bring anything in. There really isn't. You have no need to bring anything in, so don't. Dress comfortably. Don't wear a watch. Quick story. I love telling stories. One of my former students had a lot of tattoos. She had tattoos to about here. And she always wore 3/4 length sleeve shirts to cover her tattoos, which is fine. According to our school's rules, that's all that has to happen. So she was at the testing center and she had on a long sleeve shirt. And at one point she's just stretched and yawned and noticed that she left her watch on. There's a camera overhead recording everything you do. There are people monitoring the cameras overhead, watching everything you do. They saw the watch. They came in, they stopped her test, they brought her out of the room, they reviewed the tape of her test. She was fortunate. She never once looked at her watch. So they allowed her to continue taking the test. If at any time she had looked at her watch, they would have invalidated the test and she would have had to retake it. So make sure you bring nothing with you. Preparing for the NCLEX, make sure you know the dates and deadlines. Investigate review courses. There are many review courses given at various colleges and other locations. Some are helpful, some aren't. I've talked to students who have taken them, and I've talked to students who haven't. And people pass no matter which way they go. Start planning an expense account. The test is going to cost you $200 to register. Then there's your license fee, and you need a few $100s. Test courses are going to cost another $350 or $400. Test books, which is what I used, will run you anywhere from $20 to $50 depending on what you want. 2 months prior to the NCLEX, so 2 months prior to graduation, start planning ahead. Tell your employer your anticipated date. Now, you may be working for an employer that will mandate when you're allowed to take the test. There are some employers, new grads are put through a class, and you can't take the NCLEX until they determine you're ready. There's a reason for that. When you're a graduate nurse, you have a graduate nurse license until one of two things happens. When you pass the NCLEX, your graduate license becomes your permanent license. When you fail, or if you fail the NCLEX, you lose your graduate license. So if you're working for a facility under a graduate license and you lose your graduate license, you can no longer work for them in a nursing role. So many employers want to make sure you're ready. Make sure you know where you're going. Have the route mapped out. Get your GPS, your smartphone, crayons on a paper, whatever it takes to get you there. If you're taking the test early in the morning, which is when I recommend it, even though I'm not a morning person, I think it's a good time to take a test then. You may want to go down the night before to avoid that drive the day of the test. Are you going to go with a group or by yourself? Are you going to study in a group or by yourself? And if you're going to study, study. Don't just say, I'll get to it. Do it like right now. Plan out X number of hours per day and put on the calendar, I'm going to study from 3 to 5 p.m. pharmacology or whatever. The day before the big day, stop studying. Just stop. Seriously. If you haven't got enough information by the day before the test, do you really think one more day is going to do it? No. Stop studying. Put your books away. Put all your study materials away. Try to relax. I say that tongue in cheek because you're not going to relax, but try to relax. Make a test run so you know exactly where that testing center is. Make sure there's no road construction between maybe your hotel and the testing center. Go to bed early. Don't study, cram, or party. As I said, relax. Get a good night's sleep. When you get up in the morning, have a good breakfast. Do not have a cup of coffee and a donut. If you're in there for 6 hours, think about the metabolism of a cup of coffee and a donut. How quickly are those carbohydrates burned out of your system? Do you remember? 2 hours. 2 hours. So those donuts, all the energy in those donuts are gone in 2 hours. What happens after you've had a carbohydrate intake? You get a crash. So you're going to want a protein and fat-laden meal. Eggs, meat, whole grains, so that you have energy for potentially 6 hours. Dress comfortably. My PowerPoint slide says dress comfortably but look nice. Dress comfortably. They don't care what you look like. They don't. There's no grade on there saying, oh, Mary was dressed to the nines and Tommy looked like a bum. They don't care. Bring nothing in with you. Dress comfortable. Review courses. Again, there are many review courses out there, all of them with the pros and cons. Your school may have one or another. Check it out. Talk to students who have taken it. In my opinion, if you are a generally good student, if you do generally well on exams, if you generally don't have test anxiety for exams, you probably don't need a review course. If any of those other ones apply to you, you maybe do need a review course, especially test anxiety. These review courses are very good at minimizing test anxiety by giving you tests to practice. What else are the review course? Well, look at how often or how many days the course is. 3, 4, 5 days. Are they 4 days or 8-hour days? Who's giving the instruction? Most commonly, it will not be instructors from your school. They'll bring somebody in, which is really good. Sometimes you need to hear the same information from a different person, just for that different perspective. What kind of materials do they give you? Do they give you a study book? Do they give you online materials? Is the course an online course, or is it face-to-face? What kind of test questions do they use? These are all things that you have to evaluate. Where is the test, or where is the review? If you have to drive a long distance to the review, is it beneficial for you? It's going to cost you up to $400. But some review courses will allow you to retake the course if you do not pass the NCLEX. Of course, if you pass the NCLEX, that doesn't really matter. What are the statistics that the company says that their pass rate is? Do they offer a guarantee, refund, a free review? Potentially, they may give you access to an online materials so that you have an idea of what they're going to give you. How many students do they allow in their class? Are you going to be in a class of 300 or a class of 10? How about a review book instead of a course? As I said, there are 2 types of review books. The cheaper ones, $20, $30, $40 maybe, will be simply test questions. Now, the other one, the much more expensive ones, will have study materials built into it. Again, how were you on your tests through school? If you were just skating by, you probably want the study material books. If you were, a B to A student and did good on exams, maybe just the less expensive study guide with the test questions. Regardless of the book, they will all come with a disc that'll work on your computer that gives you practice tests. And what I would recommend you do before you do anything else, take the disc out, throw it in your computer, and take a test right away. Right now, before you graduate, take a test. Will you pass? Probably not. But what I will do is tell you where you're strong and where you're weak. You might have pharmacology nailed. In that case, you don't have to study pharmacology. But you might have safety and infection control. You might have scored very poorly there. Focus on safety and infection control. So that's what those tests do for you. They serve as a pre-test. Take one right away. Find out where you're good. Study as needed. Take another test. Most of those discs have multiple tests. Take another test. Have you reinforced what you're weak in? And if not, then go back and study more. If you get with a group of students, maybe you have a study group of 3, everybody get a different test book and practice testing each other. That's a way of maximizing the knowledge, because there are literally dozens of NCLEX review books out there. Dozens. And they're all good. However, there is one book that is better than the rest. I'll be honest. There is one review book that is the best, better than any other review book out there. And it's the one that you actually use. I say that kind of as a joke, but not really. I have students in my face-to-face classes that go through the entire course never opening up their textbook. I can tell, because they bring it to class and the paperback seam, the spine, is completely uncreased. They bought that book and they never used it. If you buy an NCLEX review book and never use it, it could have been the best book out there. If you didn't use it, you get no benefit out of it. So buy one and use it. Plan ahead. Set aside specific study time. You should be doing that now. If not, start. Define your study habits. Put them on paper. Put them on the calendar. Decide that you're going to study for 2 hours a day, every day, or 6 days a week, or 6 days a week. Give yourself a day off. That works for me. Do not study for 2 hours consecutive, though. Those of you that have had me in learning strategies, and I think there's one of you out there, 45 minutes. Study hard for 45 minutes. Stop and give yourself a 5 to 10 minute break. And go back at it. 45 minutes. Stop. That gives your brain a chance to process what you've learned. And when I say stop, what I'm saying is stop and go out and do something. Go for a walk. If you like basketball, go shoot some hoops. Something physical, so that your brain doesn't have to think. Go wash dishes. Do a couple loads of laundry. Vacuum. Something physical and essentially mindless, so that your body moves and your brain can start organizing that information you put in there. And that's all I have on the NCLEX exam. It's the most stressful exam you'll take, unless you go on for other education, like maybe medical school, I suppose. But remember, you take it one time. Almost all of my students take it only one time, forever. You never need to retake it. So, go back and review this information. Make sure you understand why you take an NCLEX, what the NCLEX is for. Remember, it's designed to ensure public safety. It's based on 12,000 newly licensed nurses and exactly what skills they need on the job to be safe and effective. And they're not asking nurse practitioners and nurses with 25 years in the OR. They're asking new nurses what they need to know. It's computer adaptive. Every question gets harder. You will get many questions wrong. That's okay. That's life. That's how it tests you. Be prepared. Have a good study habits. Have defined study times, and don't give up on yourself. You will pass. You will pass this class. You will pass your NCLEX. You will be an RN. I believe in you. You've made it this far in nursing school. I believe in you. And some of you I've never met. But I know because you're in this class, because you've made it through all those other really hard classes, that you're going to finish strong with me and then go on for that NCLEX and pass, and then join our profession as incredible, good new nurses who have still a lot to learn. Because your education doesn't stop when you graduate. It just changes form. I learn every day. Been a nurse for 18 years, and every time I go in the hospital, I will come out with probably at least one new bit of information. I love it. So this has been a long segment. I'm going to stop now, give you a chance to take a breath, and then we'll move on and continue this lecture.